project I'm talking about today is called the Florence Project, and it's one that involves co-designing technologies that support communication and some of the broader implications with people living with dementia and their care partners. And the research team involves lived experience experts, health professional researchers, and technology researchers. So to start with, there's this really strong push when you're working with people with dementia about the potential of technology to make differences going forward. There's a lot of hope from people living with dementia and their families, and a lot of push and maybe hype from the industry as well. But the reality is that there's been really low uptake and high abandonment of technologies that are made for people with dementia. It has been a focus of technology development for, at least a decade now, and we're not seeing differences in daily life. The other part to it is we're seeing stress and conflict related to technology use as well, and that's something we need to think about. We took in the Florence Project a focus on communication changes, and although people are very aware of the changes to memory, the changes to communication living with technology, ranging from having trouble keeping up with a conversation, not being able to find the words you want, visual and perceptual changes, primary progressive aphasias, and so forth, are less well known and less expected by people living with dementia and their families, and sometimes the teams who work with them. But the impact of these changes when we talk to people ranged from changes or impacts on relationships. So not being able to communicate your basic needs, but also that day-to-day interaction, or finding that you didn't have so many people you could talk deeply with. We also found that people, because of their communication changes, talked about perhaps not going out, perhaps not participating in roles that had been important to them before. And we also found that technology for communication is taking an increasingly important role, even for things like making a complaint, and communication technologies are difficult. So the overarching question we had is, can we do better in this space in supporting people's communication and connection using technology by designing it together and researching about it together? And so the Florence Project undertook a participatory design approach, which means the end users are engaged in the whole process of designing the research, choosing the focus, and conducting the research. We conducted a series of studies, and throughout all of it, we were guided by a lived experience expert reference group who consist of people living with dementia and care partners or regular communication partners of people living with dementia. So this is an overview of the Florence Project, which has been going for a number of years now. And you do not need to stress about it, but the stripes are the different kind of research themes. And the participatory activities are at the top, and they wrap around together. And they involved checking with people what the focus should be, asking about design approaches or research methods we were considering, checking that we were meeting priorities, and skilling up this mutual skill building so that our technology teams could communicate better with people living with dementia, that people living with dementia could feel more confident talking about technology. The next stripe was about problem space, so really understanding where technologies are used, where communication issues occur, and work done in that space. The red bar is the design activity, so when we co-designed and made technology together. Following that is more the back end of technology, so the development of automated metrics and monitoring of natural language processing and other aspects that would help technology like this work better. And then the bottom stripe is the outputs, which include applications and devices, software, and also things like publications and presentations. So right at the beginning, we went and asked people, what should we do and what should technology do? And these are some of the key insights that they provided us with, just a snippet to give you an overview. So people wanted us to understand that everyone is different and changing over time. So a single device is not going to help every person and it's not going to keep helping them. They wanted the focus of technology to make the day go better, not a plug-in symptom fixer, but something that just helped daily life go along as well as it could. They wanted to use their strengths and their skills, and they wanted to not replace people with technology, but use the technology to help with the connection and the sharing. And this is just a further example of how it unpacked a little bit further. What does it mean when we ask people to how they want the day to go better? So the part of that was to only help when I needed it. So don't have a piece of technology tapping me on the shoulder and telling me a word I might have forgotten if I haven't forgotten it. And it was this idea that we needed to support agency, that we needed the technology to be there for when it was needed, but not to intrude on people's lives and their routines. We engaged in a study looking at people's technology experiences and needs. We found a range of things. Technology was used for a purpose. It is part of everyday life. We can't escape it. Even being able to, prepare a meal or make a complaint, get money out of the bank. But also people identified occupations that they were able to do because they engaged with technology. Technology is not static. For people living with dementia, it's not just the device, it's how you learn about the device, it's how you adapt it to meet your needs, and the usability of the device changes. So people are living with a neurodegenerative condition and they are anticipating good days and bad days as well. So there's a process around technology use. There might be key times when it's most useful or when learning is most effective. Now, this is one that sometimes gets missed in making technology, but technology is for people. People have a technology identity, which helps them determine whether it's meaningful to spend a lot of time engaging with technology. People have really individual or personalised requirements, and technology should be responsive to that. And people need lots of people-based support over time to continue to use their technology. We engaged in a series of co-design and checking in with lived experience experts, both via teleconferencing, in retirement village showcases and so forth. And through this, we developed a more accessible method of co-design that is strengths-based and accessible and responsive. And there was a fair bit of occupational therapy focus on doing that. We had to work on how to make the not yet real feel really concrete and make enough sense that people can comment on artificial intelligence-based tech that doesn't exist yet. How are people able to share their perspectives? And we talked about the trouble with technology a fair bit. We engage with people on making really personalised technology. So things that were just aimed at helping one person. If tell me about a good day, how do we make more of those good days happen for you? And this was a range of things from setting up the lighting to be responsive to the calendar, to help people who had apathy, or to help someone who had apathy as a primary kind of concern, and to make areas of the house more welcoming at certain times of day in the hope that people will engage with their valued activities in that place at that time. Things like sharing views with people who are remote to you, music players, reminders, and so forth. We wanted to see what already worked well for them and build on it rather than replace their strategies. And we wanted to start to understand if we could improve everyday technologies, which people use a lot, through understanding what works well. So we came up with this overarching requirements for a technology system that would help with communication and participation. It was a system for a start, as I said, not a device. It can be personalised and it can change over time. It's easy to use and it doesn't cause harm. It knows enough about me to be helpful, but doesn't know everything. It's not scraping data unnecessarily, and it's not too helpful. It lets me do the things I want to do. It's really transparent about how it works. I can look into it and see why it made the decision. Why did it turn on that light in that room? So it feels safe and not too creepy. and it works in with what's working for me, with all the people in my life, with all my strategies I'm already using, and it doesn't disrupt them. So here's my not very techie version of what we started to look at as our system that we're proposing. So right in the centre, there's a life library or a language bank where people's personalised information, the glossary, the words they use. When I say Bob, who am I talking about? Their biographical information, their routines, plans for the future as to what might be helpful, and some structure around how and when things should help. Now, it's potentially attached to a whole series of interoperable devices, so only the ones that you want. So it might be that you attach your calendar to it, and that both draws on the information from the Life Library and adds to it. It might be smart home things. It might be simplified social networks. People wanted to be able to pull out information about themselves to share at their next doctor's appointment, or if they were going to hospital and were worried about being able to share important things with the staff. When we consulted with people about this, the control centre became really important. People wanted to tell this device about themselves. They wanted to check what it knew and why it was making decisions and change it if it was wrong. And also set up who else could have a look at this. So this is the language bank and what goes into it. It's stored in the home. People use metaphors for it that work for them. And we need to look at how it learns and uses the information and who's in charge of it. At the moment, we're building clarity by working with people through these concepts. We're testing prototypes, and the next steps are towards living with a system like this. I'm really interested in the OT role in co-designing technology and expanding these concepts. This is our funding. We acknowledge everyone who's contributed to this project so far and invite people to make contact if they're interested, want to collaborate, or have any questions.